appropriate time. Who's next? Senator Wyden.
Thank you very much, Mr. Chairman. Colleagues, this instruction is to, in effect, prevent Medicaid from being cut. We would strike the finance instruction because it allows the opportunity to cut Medicaid. And as I said, our choice here is, are we going to be there for working people? Because most of the folks who are on Medicaid are working. They're also taking care of families, and they're walking an economic tightrope every month, balancing the food bill against the fuel bill and the fuel bill against the health care costs. And we had some discussion earlier about, nursing homes. Nursing home patients take much of the Medicaid budget. So if you're for the patients, if you're for vulnerable people, and I'll just close with this. The Senate is a rural institution, and you get these deep Medicaid cuts. And by the way, House Republicans released their budget today. Their plans spelled out what's ahead, colleagues. This is not some abstract deal. There's cuts of nearly $1 trillion or more aimed at Medicaid. And for rural America, for the vulnerable across the land, this is the safety net they rely on. So I'd urge all my colleagues to support striking the finance instruction, because otherwise we would open up the door here in the Senate to cut Medicaid, and that'd be a grave mistake.
Senator Crapo.
Thank you, Mr. Chairman. First of all, I just want to make the point, this is not the House Republican budget that is being proposed to be considered in the House. This is a very specific budget reconciliation bill that focuses specifically on border, on national defense, and on energy enhancement. There is a very narrow, as I explained in my introductory statement, a very narrow instruction to the Finance Committee that focuses solely on nursing homes, not on Medicaid. And it focuses on a nursing home regulation, not on a spending authorization. This regulation, by the way, if implemented, would increase taxpayer costs by billions and jeopardize patient access in rural areas to long-term care. This is going to help patients and save spending.
Mr. Chairman, very briefly.
Absolutely.
As I said, earlier, what this rule means is we'll have a lot of nursing homes in America without nurses. And there has been a great effort to try to work out something in this area that would be bipartisan. For example, as I mentioned, rural areas being so important in the Senate, we give them 5 years, essentially, to work this out. So I would just say, I think it'll be a grievous error to cut the most vulnerable in our society. You can prevent that by supporting this amendment, and I yield back.
Thank you. All time has expired. We'll vote at the